my first video about dentistry. First, my name is Dr. Nguyen. You can call me Dr. Nguyen or Dr. Nguyen. Either way is fine, or Dr. Nguyen. If you haven't watched my introduction video about my goal, about all my video, please watch it. I put the link below. As for today, I would like to move on with a topic that pretty sensitive, that a lot of people or a lot of patients doesn't want to talk about or don't want to mention about. But actually I see this a lot, almost every single appointment in dental office or dental clinic. And as you can see in the topic, like in the title of the topic, it is why people are scared of dentists and what can we do, which means what can I as a dentist and you as a patient do to make it better or to overcome this and make you not scared of dentists anymore. So it's a role like of a dentist, and also it's the responsibility of the patients, because we work together, because if not, it's not gonna work in this way. So now next I want to talk to you about why are you scared of dentists. Why whenever you heard about dentists or you come to the dental office, you see a doctor, you see a white coat, which people call a white coat syndrome. You see the doctor, you see the dentist, you are so scared, especially the dentist. First, I want to analyze and face it. So let's face it together, okay? Me and you face it together. Because if you face it by yourself, maybe you will not, okay? So I will help you try to face your fear together with you, okay? First, in order to know how to overcome the fear of the dentist, we basically have to analyze why are you scared, what happened, what make you scared, and why you scared of those things. Okay, so I will analyze that part. I will talk about how to overcome the fear. After every single problem that we identify, I will come up with a solution and the way to overcome it, so you will know. So after every single reason or every single problem, I will come up with that. So you will hear that throughout the story. So that is the summary about it. So let's start. Okay, first, number one, you might want to pause the video a little bit to think about it for like a minute or for 30 seconds and think about it. Why? What is the thing that you scare the most when you go to see the dentist, and what make you scare the dentist? Okay, what is the most, like number one reason? So I give you some time. Okay, so time up. I will first, number one, that, and this is according to my experience with patient. Okay, so according to my experience with patient, is number one thing that why patient is scared of dentistry is because they have a bad experience in the past. What I call is bad experience in the past is basically they might have bad experience with previous dentists, different dentists before you come to because they come to my practice, or anything similar to that make them painful or make them remember forever, is like obsessed with, and they are so scared of that. Okay, so whenever patient come to my practice and they say that, oh doctor, I'm so scared of dentists, I have bad experience in the past, then what I gonna do? So I think I and also other dentists need to identify the problem. So I right away I sit down with the patients. Well, of course, before that I was standing because I just say hi to patients. Okay, so I will sit down with the patients. After I sit down to the patients, I will listen to the patients and ask different questions to identify what the problem is, and ask the patient and make patient feel more comfortable to share their own story. Okay, so let's say for example, Susan, I confirm or assure with her that she will have a better experience, and I'm here to help, not to harm her. Basically, automatically, I am become her friend, not her enemy, right? So after that, she will kind of be more open to me. And when I say that she be open to me, and she will share a little bit more about that, say yes, I would try with you. I heard a lot about you, and I heard it's a good thing. That's why I come here and let you help me. So then you will guide patient through step by step in the next procedure or anything, so they will feel that, oh, they in the procedure with you, and they will feel much better. So what the lesson we can learn about here is basically, number one, if you are patients and you're scared of dentists, when you come to the dental office, please say it right away with the dentist that I'm scared of dentists because of this, because of that. Share your story. So why? So we, or as a dentist, we will identify your problem. We will like sit down with you and talk to you like I talked to Susan, and after that we will come up with a plan together to help you and make you overcome your fear. And I have so many ways to overcome the fear with dental, which I will share later on if you continue the video with me. But that is one of the way that you can do when you come to see a dentist. Okay, so the the second thing is basically, what can dentists do in this situation? As a dentist, as a provider, as a good provider, okay, you need to sit down with the patient, listen to the patient, learn from it, learn from their experience, identify, analyze it, critical thinking about it and everything, and show them that you are willing to help them, and show them how can you help them too. So that will help the patient feel better. So that is two things. Okay, so that is the reason, number one reason that I see about why the patient is so scared of dentists. Now I will move on to number two. Okay, so number two is basically, when you see the dentist, the reason number two that you are scared of a dentist, okay, so I will tell you now. The reason number two that I know, or as I see, is injection. So why I say about injection, and when I say about injections, everyone understand about like why I talking about the injection. Because why? Because every single one afraid of injection. Even as a doctor, when it's their turn, they're afraid of the injection. Well, there's maybe some exceptions, which is me. I'm not scared of needle or injections. Even when I was a kid, I'm not scared of it. Maybe for the first time, but I was brave about it the first time. And when I was in high school, when they do their injection for me, because at that moment I was specialized in biology major. I was basically look at them, or look at the needle when they do the injection for me, or look at the blood too when they withdraw the blood from me. So is fine for me, but I'm just saying majority of populations of everyone is, they all scared of injection of needle. So when they hear the word needle, they scared. When they see the needle, they scared. When the needle about to come to them, they scared. Okay, so even they're big guy, like, you know, sometimes going to the you know, the prisoner, when sometimes I have to, basically sometimes I treat the prisoner. They come to you know, a clinic, free care clinic or something like that. We treat the prisoner, and even the big guy, like big muscle and everything, and when you pull out their needle, they basically so pale and will like almost pass out, and you know, like they so scared of the needle, or even cry. Some people even cry when they see the needle, and talk about the needle. So that's why the needle is very sensitive word, that basically I won't say the word needle with my patients because I'm afraid they will be scared of it. The second rule for me is don't say it. Second thing, don't show them the needle. Like I never, almost never, unless by accident or the patient want to see it or something, but no one wants it. Always hide the needle behind my back. So when I prepare the syringe, needle, everything, I put it in the back. I prepare in the back of patient. The patient's chair is here. I'm here preparing, and then they won't see it. When I'm done with it, about to open to do the injections, I ask the patient to close their eye, or they have a dark shade so they won't see. And then I come in here from the back. I put the needle in the back here, and then I come here. So then I do the injection, and they won't see the needle. Okay, so what can I do, or what can dentists do to make the patient feel better about the injections and make it the injection is less painful and feel more comfortable to the patient? A lot of patients comment on me, or like compliment me on injections. They say that Dr. Nguyen do the injection is so nice and gentle. I don't really feel, sometimes I don't even feel the needle. So I mean, I appreciate the compliment, but I take a lot of time, and I, you know, take time, sit down with patients, slow down everything, make everything slow, and make them feel comfortable during the procedure. So there are several things that I do to make sure that patient feel comfortable during the injections. Number one is basically I will explain to the patients why, or a lot of people, what is the reason why a lot of people feel pain during the injections. So usually before the injection, I tell the patient and say, okay, so do you know that a lot of people think that it's just the injection pain is from the needle when it poked through the cell or the membrane in there, on the top layer, it's hurt, and it's that they think that is painful from that, but or the moment when the needle enter the cell, but actually it's not. So you might be surprised because of that, but it's not. So the pain of the needle that going through, yes, they're pain, right? But I'm sorry, there is some noise, like something happened there. I don't know. Sorry about the background noise. So when they do that, right? It's, yeah, they're pain, but it's not a lot, right? It's very fast. But the pain that you have from the injections is most of the time, which is all the time actually. So the pain that you feel is the pressure. So, you know, when you do the injections, right, the liquid go into the cell, right? So when the liquid going to the cell is expanding. So you just think about the cell as a balloon, then you blow it, right? Then it will be like this, and then it expand like big one. Then the faster you do the injections, which you inject right away, like very fast, the more of the cell, the faster that the cell will expand. And the faster the cell expand, the more like what you call that, tensions, the more tensions that gonna appear, like happen. And when it's a lot of pressure, a lot of tensions, then you feel hurt, like really bad, right? It's a lot painful. It's a lot of pain. So if so the conclusion is here is what can help the injections is basically do the injection very slowly. Okay, so that's why I always take time with the patient. Whenever I do the injection, I do it super slow. So I just do like little per second, very little, slightly. Like if you look at my motion, you might not even see the syringe move or the stop button that move, because why? I take time to do the injection. Patient might have a needle in there longer, but it will help them in the long run, that they won't feel as much pain. Okay, so that is the number one thing that I use to make people feel more comfortable during the injection. The second thing I do, that I mean the main thing, right? Another thing I do is topical gel. I'm pretty sure that's all of the dentists, most of the dentists now in the US use the topical gel to help when you put it on the surface of the cell. Basically it will numb it on the surface, and when the needle poke through the cell, you won't feel that pain because it's already numb, or it helps with the pain. So also I think it's more like psychology, because when you put it on the site, the patient say like, oh, I know that she about to do it, so they prepare it come to do the injections. So so that with the psychology, and also help with the pain on the top cell, right? Then that's the second thing to make feel comfortable. The third thing is basically I do a lot of massaging. So when I do the injection, for example, in this spot right here, we do a lot of injection in this spot right here, for the what we call it IAM block, or the block for the mandibular, for the lower jaw, to get numb whenever you do any filling or any dental procedure on the lower. So it's right spot around here. So when I do that, a lot of dentists do shaking, like that, shaking. But I don't do shaking, because the reason why I don't do shaking, because I'm afraid that the needle moving like that might come out, or it might hit something, and I don't like that. So what I do is I do the massaging. So I put my hand like that, and then I just massage around here. So it's help distract patients, because basically the injection is here, but I extracted that, I massage here, so they won't feel it here. And then the massaging help the patient relax, and also the massaging not making the needle shake or be dangerous, is safer, and then is feel more comfortable that way. So that is another way that I do. Another thing is I have to tell to number 4 to help with the injections, is basically I tell the patient about timing. So whenever I about to end the injections, I will count. So I would count from 10 to 1. So I would count like 10, 9, 8, 7, blah 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 to 1. and then patient know that, oh, in 10 more second, or you know, like she count down and I'm almost done there, and I'm almost done there, keep fighting, you know. So it's help with the psychology, and it's help for patient be prepared for that. So I don't know about if you know about a story. There are a girl that she joined the Olympic. Well, I think I just heard this from, maybe it's not from Olympic, or I make it up, I don't know. But basically she is a she in the competition for swimming, and then she almost there to the final destination, and she was, it's a very foggy day. When she swam, she didn't see anything, so she keeps swimming, and then she doesn't see anything. So she get frustrated, she get tired, she lose energy, and everything went down, and then she gave up. Then when she gave up, later on she find out that she only about 1 meter from the destination, so she almost there, right? But so that's just the thing. So when you're about to come to an end and you don't know where is the end, is you feel it extremely long and you feel it tired, frustrated. So you don't know, because you don't know what's gonna happen. You don't know what's gonna waiting for you over there, the destination. When is the destination thing, then you will feel longer. So the same thing with the patient is psychology. In their mind, they will like, okay, because they hate needle. So when you put it in, right, you do the injection, they will think like, when it's gonna be out, right? When the needle will get out of my face. So if they think like that, and we're like, oh my god, why is so long, why the doctor takes so long, like when's gonna be done, it's in their mind, like when I'm gonna be done with this. And then you give them the signal, you say, it's about to be done, you almost there, keep fighting, you know, you almost there, keep fighting, it's gonna be done. It's like 10, 9, you count it, and the patient feel like, oh, you care for them, and they feel like, oh, I'm almost done, like keep fighting, almost 10 more seconds, then I will be done. So that is really help with the patients as well. And then so that is the 4 kind of method that I use to make patients feel more comfortable during the procedure. If you are a patient that listen to this, please share with you know, with your dentist, or your dentist might already use it. If you think that it will help you. If you are a dentist watching this, then I mean, I hope that my tip will help you, or you might already use it. Then share with me another method that you are doing better than me. Then I will learn from you. So you know, so that is the second reason why you are scared of dentists. I know this video is kind of long, but because you know, it's just talking about a fear that, you know, a big fear, then we must have a lot of reason and a lot of talk. So I hope that you're gonna follow me through the